President Obama's healthcare reform plan has many angles but one goal: to make healthcare affordable. According to the White House website, the plan will implement new cost-cutting measures like placing caps on out-of-pocket expenses and providing the option to enroll in a publicly funded health insurance plan. Some Long Island experts feel the current plan fails to address some of the key economic issues surrounding healthcare.
Tort reform would be really important, such as putting a cap on the malpractice suits. I do think that there's a need for malpractice. I do think that unfortunately things happen and people need to be compensated for it. But when I know that the lawyers are getting 40–50% of a payment, well then really the patients aren't being compensated. It's going in to pad the lawyer's bill, and I have a hard time with that.
A Long Island plastic surgeon will pay $84,000 a year on average in malpractice insurance, pennies compared to the $300,000 a Long Island neurosurgeon will pay, a cost that gets passed on to their patients. Brooke Ellison is a doctoral student at Stony Brook University, studying health policy and the relationship between medicine and society. She agrees that tort reform will help, but says the plan has even bigger flaws.
Well, the proposal as it is right now doesn't go as far as it should to universalize healthcare coverage. It would significantly reduce the number of uninsured or underinsured, but wouldn't go all the way.
Ellison says the current proposal fails to address healthcare costs for people like the 100,000 New Yorkers that experience homelessness each year, or the thousands of families that cannot afford insurance premiums, even on a public plan. According to the American Journal of Medicine, nearly 40% of all bankruptcies stem from healthcare costs.
That should never be. That should never be the case, that somebody who, out of no control of their own, gets sick and ends up without food on their table, without a roof over their heads, and that's what we're facing right now.
For the Stony Brook Independent, I'm T.C. McCarthy.